Stephanie Bell-Flint joins us now to talk about pancreatic cancer. And if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us, Dr. Randy Voyles. He's a general surgeon with Baptist Medical Center. Thank you, Dr. Voyles, for joining us.
Thank you.
Pancreatic surgery has really come into the news of late because so many celebrities, or a number of celebrities, not so many, but a number of celebrities have had it. What is pancreatic cancer?
Well, the pancreas gland is a gland across the backside of the abdomen, and it basically has two functions. It makes juice that helps digest food, but it also makes enzymes and hormones that control insulin and control other metabolic functions. So if you have to have a cancer, you'd rather have the cancer that comes from the tissue part that makes hormones as opposed to the drainage, the duct part. The most common kind of cancer of the pancreas is the ductal cancer of the pancreas.
Would you compare the difference between surgery for pancreatic cancer and, say, surgery for gallbladder, things of that nature?
Well, gallbladder disease is real common in Mississippi, and indeed, I've done 6,000 procedures with
Wow.
the laparoscope for this. But it's done all across the state in most medium-sized hospitals. Cancer of the pancreas has changed a lot in the last 30 years, and one of the things that's really changed is that more and more patients with these complex cancers are referred into centers with specialty interest. And we at the Baptist Hospital have a full gamut of highly sophisticated specialists in interventional radiology, gastroenterology, pathology that's required to have a good outcomes in surgical patients.
Okay. Question from a viewer. I was diagnosed with pancreatic cancer back in 2007. Dr. Petro at Baptist Hospital did the Whipple procedure. I had follow-up radiation and chemo. I will celebrate being a 5-year survivor.
Wow.
Great news.
Wonderful.
The question is, what is the possibility that it will return as pancreatic cancer or another form of cancer? And will the symptoms likely be similar to before? They were severe itching, scant dark urine, white stools, and weight loss.
Well, that patient presented with an obstruction to the bile duct system, which interfered with the flow of bile into the GI tract, and that's why they had the itching. She's 5 years out. She's almost certainly cured of that cancer, as opposed to the cancer that Steve Jobs had. Steve Jobs had one of the endocrine kind of cancers that we actually do the best with. We have longer survival. The surgery is not nearly as complicated, and sometimes even when you have the cancer that Steve Jobs had, we can resect the metastasis and patients still do well.
Okay, so do you think that the symptoms would be likely to the type of symptoms that she had before should another form of cancer happen?
If she's 5 years out with pancreas cancer, she's probably cured.
Wow.
However, if she had recurrent problems, they probably would be loss of appetite, weight loss. I've been taking care of these patients for a long time. Unfortunately, the cure rate's not as high as we'd like for it to be, but I do have one patient from Hazelhurst that's 22 years out after the same procedure. So there are glimmers of hope. It's some patients with appropriate surgical care after good staging, good chemotherapy, can have long-term survival if not cure.
How do you become at risk for pancreatic cancer? I mean, do you do things? Is it lifestyle things, or is it? I mean,
Genetics?
Genetics? What?
Unfortunately, the biggest risk factor is just getting older. Okay.
Wow.
Of all the behavioral things, the only thing that we really know to do is avoid smoking, right? And perhaps choose your parents well, because genetics play a small part in it, but there's really not a whole lot of things that you can do with cancer of the pancreas. There are not that many risk factors for it.
Which, by the way, she says she celebrates her anniversary getting a purple pedicure every year. I like that.
That is wonderful.
You need to have purple for pancreas cancer like the ladies have pink for breast cancer.
Yeah.
Works for me. Dr. Randy Voyles, a general surgeon at Baptist Medical Center, thank you for sharing your information with us.